my name is Dr. Colin Zhu. Thank you so much for watching this video. A little bit about me, I'm double boarded certified in family medicine and lifestyle medicine as well. How I came into food as medicine is really about helping others to thrive. And so I took a lot of detours, went to culinary school, got my health coaching certifications just to help my patients with that extra touch.
Hi, my name is Terry Stone. I'm the Medical Director of Fresh and Savory Culinary and Lifestyle Medicine, Shared Medical Appointment in Washington, D.C. I'm board certified in internal medicine and lifestyle medicine.
So what and how we eat can be such a daunting topic. Sometimes our lives center around food and eating. Think about any major holiday and the fact that our table is our center for gathering. Today we're going to discuss how food can be used as medicine.
The standard American diet lacks enough fiber, calcium, and several key vitamins and minerals, while it oversupplies our bodies with sugar, sodium, and saturated fat. A primarily whole food, plant-based eating pattern promotes overall health. Plants are by nature rich in the nutrients your body needs, including fiber. Increase your daily amount of vegetables, fruits, whole grains, beans, legumes, nuts, and seeds, and drink plenty of water. Decrease the amount of saturated and trans fats, refined or processed carbohydrates, processed oils, added sugars, salt, and chemical contaminants. Focus on the food that is whole in its original form and comes in its own packaging.
Extensive scientific evidence supports the use of a predominantly whole food plant-based eating pattern as an important strategy in the prevention of chronic disease and treatment of chronic lifestyle-related conditions. With intensive therapeutic doses, we have seen potential remission to chronic lifestyle-related illnesses. As we talk about chronic disease, it's important to realize we are discussing a wide range of conditions, such as obesity, type 2 diabetes, high blood pressure, coronary artery disease, fatty liver disease, anxiety, depression, dementia, and insomnia, and much, much more. The NOVA classification system is widely used to categorize foods based on 4 processing levels. It starts with unprocessed, fresh, and frozen fruits and vegetables in Group 1 and progresses along the processing spectrum until it reaches ultra-processed foods in Group 4. The ultra-processed foods and drinks in Group 4 are industrial formulations, typically with 5 or more ingredients, such as added sugar, oils, fats, salts, stabilizers, and preservatives. They typically have a long shelf life and have hyper-palatable flavors, which can encourage overconsumption. So what do we mean by whole food plant-based? Well, a good analogy would be if it didn't grow out of the ground, off of a tree, or off of a vine, like Mother Nature intended to be, we would recommend to minimize it or to avoid it as much as possible. So what is whole food? Whole, intact, okay? Processed means to break this down even further. Processed foods are high in calories but lack essential nutrients due to the removal of nutrients during processing. This could lead to weight gain and chronic diseases. In contrast, whole foods are naturally nutrient dense with ample water and fiber. Whole foods take longer to chew and digest, expand the digestive system, and keep you feeling fuller for longer. They also tend to have fewer calories per volume, allowing you to eat more without consuming as many calories. A study revealed that a diet rich in processed foods resulted in extra 500 calories consumed daily, leading to a 2-pound weight gain in just 2 weeks.
The Blue Zones Project studied geographical areas with a high concentration of people living to be 100 years old and beyond. These populations tend to eat mostly plants with less meat and dairy compared to the average American. Eating animal products in large quantities several times a day can cause inflammation and increases your risk for chronic diseases and can actually shorten your lifespan. Now we have the most evidence for plant proteins in the areas of disease reversal. So we encourage you to focus on whole fruits and vegetables and eat a rainbow of color. Eat a variety of plant proteins like beans, nuts, and lentils, and choose whole grains, add herbs and spices for flavor and antioxidant power. How do we work towards a whole food plant-based diet if we're on a tight food budget? Eating simple plant foods like beans and grains can actually be less expensive than many meat products, oils, and processed snacks per calorie. But learning to cook and meal plan can ensure you stay on a budget. Some tips that can help include looking for in-season produce, buying frozen fruits and vegetables, and buying grains and legumes in bulk.
Food is often an essential part of many cultures, and it's often incorporated into our traditions and customs. There are several strategies to enhance the way you eat food. We just need to follow the principles of shifting towards more whole foods and plant predominant. Some strategies for doing this include a protein flip, incorporating smaller amounts of highly craveable foods with more vegetables and whole grains. Experimenting with healthier cooking techniques, shifting away from frying and more towards stewing and steaming, and adding more flavor with herbs and spices and decreasing salt and sugar.
Cooking and eating healthy are tools that can empower you and your family to live a long and healthy and happy life.